Okay, welcome everyone. We are doing this approximately hour-long presentation on intros to insurance navigation for gender-affirming care. We have a lot of providers here with us and other people who do care navigation. So I'm really looking forward to, please speak up, give us tips. We all don't know everything, and I would love to find out more. So introductions, I am Nora. I use she and they pronouns. I am the facilitator unicorn at QueerDoc. So I do all the things in the background. I do emails and voicemails. I do our introductory appointments for new patients to help explain how QueerDoc works. I manage our blog. I do care navigation. It says queer, non-binary, poly, neurodivergent, disables, and I am nervous because I don't normally do this a lot. And I am presenting from unceded Duwamish territory. And Dr. Crystal Beal, who is the founder and owner and CEO of QueerDoc, is here to assist me today. What we're planning on doing is we're going to go over terms and resources, then talk about how to find your documents that will tell you what your insurance does cover and how to understand them, who you're going to call when you have to call someone, the denials and appeals, what happens if you get denied, and then open it up for questions. First off, if I can make this happen, words to know, all the terms. We start with procedures, policies, payments, and appeals. The links on the screen are to two of the pages we have up on the QueerDoc website. Tips for talking to insurance and our insurance dictionary, which goes through a lot of the terms. We'll also go through them here, and we'll be sending you the resource with the links is going to be on our CME site. So you'll be able to download it and have all the links. First off, procedures are the things, of course, that are going to happen, and they are described by a CPT code in medical speech. Often it's what's going to happen, how it is planned on being done, like if it's, in this example, laparoscopic surgery, and with what tools. Sometimes they can be extremely detailed. Sometimes you may need to change CPTs to get the right item for insurance coverage. Thankfully, most plans will tell you what CPTs they use. And the example here is for an orchi done by laparoscopy. When I get nervous, I stumble over words, and it uses the CPT code 54690. CPT codes are always paired with a diagnosis code. Currently, most of what we do for gender affirming care is paired up with the diagnosis codes F64.9, which is gender identity disorder unspecified, or E34.9, which is endocrine disorder unspecified. We don't like the term disorder. We're not a disorder. There's nothing wrong, but it is current terminology. We are currently using the set of codes called ICD-10. The next set, which is ICD-11, will be using the terminology gender incongruence, which is pretty cool. But we are unlikely to see the next set of codes in use until probably 2025. It takes a long time for each set of codes to get put into all the databases everywhere, essentially. Although ICD-11 was just released in January. So it is out and about in the wild, and we'll start seeing it more and more. For surgeries, most insurance companies require that you submit paperwork using F64.9, and they won't cover anything if you use the ICD-10 code E34.9. Pause for questions if anyone has them.
I think it's just a good distinction. A lot of times providers use E34.9 to provide extra protection for our patients. So when someone looks at their medical records, they can't automatically see that you don't automatically get outed, right, as gender diverse. But we can't get surgery covered under that code. So we do have to end up putting the gender codes onto your medical record. And in the world of electronic medical records, it's really hard to get those off. That like paper trail just kind of follows you. Well, it's not paper, that digital trail just kind of follows you wherever you go. That's kind of why we have the different codes up there. So
thank you. The diagnosis policies. So on your insurance side, this is all the information about how your insurance company makes decisions about how they spend money. Part of my background is I spent several years working in a combined insurance and care delivery company, and I was on the primary care policy team. So we would be looking at the evidence, crunching all the numbers to decide what we would then recommend to the insurance part of the company that we should pay for our patients. This goes on in every single insurance company. So there is a team of people somewhere crunching a lot of numbers and looking at evidence, hopefully, to determine what gets paid for. Did we want to stop and break for the question?
There was a question about, would the endocrine disorder code be appropriate if one isn't getting HRT?
I think that's probably for you.
So I think it's an appropriate code to use for medical visits with someone if they're, that's a really good question. I guess I would wonder if they're not getting medically prescribed HRT, why do I need a medical code for the visit? Like, why are they coming to me as a physician? Right, it wouldn't work for a surgery referral because surgery is just like not covered under that code. So the insurance company just like will say that code doesn't include coverage for surgery. And then we use it typically to cover visits where we do see people to prescribe. I've had consults with patients where, you know, they talk to me about treatment options and decide none of them really fit for them. And we still use that code, but they don't necessarily come back a lot, I guess. Did that answer your question, Alex? Do you have a clarifying question? Did I make any sense at all?
That did make sense. Thank you.
Okay.
Philosophically, I would say it is potentially appropriate because you don't have to use hormones to treat an endocrine disorder. You can just have the endocrine disorder. So, but I am also not a coder, so.
Yeah. It's just the endocrine system controls the body's hormones. And so if someone thinks there's any potential incongruence with their hormonal state and, you know, what they want for their body or their gender or their mind, like that's how we code it that way and feel ethical about it. And so even if they don't end up getting prescribed things, but they do feel like there's some incongruence for them, like it still fits. It's just typically those people don't come back a ton for medical visits. So you don't end up coding a whole lot.
Okay. To move on, your policy documents will also tell you what your covered benefits are and if there's any excluded care. Excluded care can be the tricky part. National federal law right now protects us, and gender affirming care cannot be categorically excluded, but there are lots of loopholes. So that's where you may need to get in with your insurance company. They may try to exclude gender affirming care by calling it cosmetic or elective. And the fact is that it's medically necessary. So cosmetic and elective say that you don't have to have it, so therefore they don't have to pay for it. When it is medically necessary, it is how these things are treated, and they need to pay for it. There's probably better ways I could explain that, but that's the most concise way. They will usually have a portion of their policies say that they will cover medically necessary care. So therefore you make them stick to it. Really, really great resource to find out more about how to find out what is in your insurance policies is the National Center for Transgender Equality. They have a great set of step-by-step instructions. We'll also be going through some policies in a couple minutes, so you can see in this presentation what they look like, where the terminology might be. Okay.
And Nora, correct me if I'm wrong. My understanding of the federal protection is only for federally funded plans. So like Medicare, Medicaid can't exclude gender care, but private insurance plans still can, like categorically exclude it if they're funded by the employer and they don't take federal money.
There are some grandfathered plans that can categorically deny. I believe recent, I'm blanking on the word, federal policies are that you cannot categorically deny unless you're a grandfathered plan.
Okay.
We can double check that and confirm it.
Also, we should come up with another word than grandfathered because I think it actually has like pretty racist.
Yes, we should.
So we'll work on that, correcting that in our language moving forward.
Thank you for pointing that out.
Of course.
More policy terms to be aware of is network. And network is, you'll often, it'll go right in hand with preferred provider. And that is providers that have signed up with your insurance company to work with them, usually on a fee schedule. So your insurance company will have different costs for you for providers that are in network and a preferred provider or out of network. Often out of network, you might have to submit documents, pay cash, and then get reimbursed for care by submitting a lot of paperwork. And then the meat of what we're going to be talking about today later on is pre-authorization and prior approval, which is when you contact your insurance company before you're getting care, before a surgery, to say, these are your policies, I am planning on having this done, will you or will you not pay for it? It's a process. And then another medical policy term to remember is durable medical equipment, which is often just DME. And that is things like compression vests, blanking on others, but any items that are used more than once, so they're not disposable, that are a medical need, often they are covered as part of the plan.
And your provider can write a letter of medical necessity for you for anything like packers, binders, STPs, hair prostheses, like all of these things can be determined medically necessary, and your provider can write a letter for that and then some insurance plans will like fight you for it and it'll be a process, and other insurance plans will just be like, yeah, here's your money back, or we don't actually reimburse for this, but you can, what is that thing when it's your pre-tax dollars? It's a deductible medical expense if you're filing taxes, if you have a letter of medical necessity.
Thank you. I knew there was more, but I was not thinking of it. Next up, in words about payments, you have your deductible, which is The amount of money your insurance wants you to spend before their coverage starts kicking in or their full coverage starts kicking in. Co-insurance is amount of money, I believe, after your deductible that you pay part of the fee along with your insurance company. Allowed amount is the total benefit that you can use in a year's time or in a lifetime. Out of pocket is the money that you spend. Often you will have an out of pocket limit as well, that you will not be asked to spend more than that amount of money in a year's time. You should be aware of surgical fees when you are scheduling a surgery. Often the surgeon will have a fee. The anesthesiologist will have a fee. If you're having surgery in an outpatient center, the center may have a fee. And those may not be covered immediately as part of your insurance. So when you call your insurance to ask, how much is this going to cost me? That information you get might not include those other fees. Other bit is transportation. Some insurances will cover transportation to your surgery, may cover housing if you need to travel, like out of state or a significant difference and you need to stay close to your surgeon for however long. Medicaid definitely covers it. Any questions, any points, Crystal?
Like some insurance plans even cover transportation for like an assistant. Like if your surgeon says you need someone with you post-operatively to help take care of you, some insurance plans will also cover their travel. Some won't, but it's worth asking. And then your surgeon would have to write a letter basically saying you need that person.
Medicaid, and I know Washington Medicaid will also pay for transportation for all of your doctor's appointments. So it's a great benefit to use. And Washington law, we've had several people signing up for this asking about Washington law that went into effect on January 1st. This law said that all state regulated plans have to cover gender affirming care. And it expanded the list of gender affirming care it covers, and it includes facial procedures, hair removal procedures, and tracheal shaves. There is some confusion because it does not apply to self-funded plans, which are what most employers have. So if you have an Apple Health plan, like a Medicaid plan, or any plan that you purchase off of healthplanfinder.gov or WA.gov through the state ACA marketplace, it does cover gender affirming care. So, any questions about that? I don't know if we have any Washingtonians here with us today.
The question is, do you have recommendations for leveraging that law if someone has a self-funded plan?
We have, later on, I'll be referencing, again, the National Center for Transgender Equality. They have an excellent, excellent letter template to send to your insurance stating all of the current laws that apply to gender affirming care. And
so the new law, if your insurance is through your employer, the new law does not affect your plan, so it doesn't apply to you. But the letter Nora is referencing can be used with any insurance company, even though the laws don't necessarily require self-funded plans to follow them. It's legalese talk that can be a little intimidating and can potentially help with the push.
So you can cite all of the laws saying this is community standard, this is currently required of other insurers. Don't you want to do this too? Or Washington also has a 2015 law which covers all health insurance, which can be supportive, and that that it's gone into depth at trans quality. So we'll have those links available to you. So websites in Washington, there's the Apple Health Medicaid transgender care program, the law itself, and we published a blog in December, I believe, talking about what happens for Washington. Other states, if you're looking for care, Out to Enroll is amazing. They break down all of the major plans for each state and how affirming they are. So you know which plans will deny care and which plans will cover care if you're looking for care on, I think it's both private and on the network. And then the Movement Advancement Project does state-by-state maps indicating laws that will protect you.
And then Alex added that the, I'm blanking on what TDLF group stands for. It's the Trans Defense, I can't remember. But their transhealthproject.org is also very helpful with understanding trans healthcare. And they have an insurance tutorial and information on medical necessity. So thank you for that, Alex. And we will add it to the resource sheet before we upload it for people.
And they have it.
Okay.
But yes, definitely. Your documents. So the documents that you will have access to, you should get a member packet or an employee benefit guide when you enroll. You should be able to download it from online. If you get your insurance through work, contact HR, and they should be able to give it to you. This is a snapshot of my medical benefits. I get them through my partner. You'll see all the terminology of deductible, co-insurance, et cetera, in plan, out plan. I just wanted to give you a look at some of the information you'll see. Then let's take a trip. I am going to stop sharing this presentation and we're going to look at my actual insurance company. And share. Oh. Hold on just a second. And we're going to share this one. So, I'm a Cigna member. This is what I see when I log in. So, oops, we didn't want that. I meant to do this beforehand. Hold on just a sec. Unshare. And we'll get to the right place. Sorry for the delay. They also changed everything. It was a different format. And now it's being very slow. All right. Okay. Well, we might not do that and go back to sharing the presentation.
Do you want me to try to pull up my plan?
Sure, if you want to. Oh, hey, mine just decided to show up.
Okay.
So we can do this.
Okay.
hopefully this will be what we want. So somewhere on your insurance website will be information about coverage. And I'm going to main features of the plan. So for me, I have in-network and out-of-network, but what we care about right now is to download the available plan documents. If I click on that, it will show me my plan booklet, which is that. I can download it, it's fine. And then for a summary of benefits and coverage, I would have to call. Now I'm going to stop. And we are going to go back to sharing the presentation. Yes. Okay, we are back on that. My plan booklet, absolutely useless. No information at all about gender affirming care. And it told me to call customer service to get a summary of benefits and coverage, which should have all of the information. They told me to look at the website. I told them I'm on the website. The website tells me to call you. They said, oh, okay. And maybe I got a copy mailed to me. I called earlier this week. I haven't gotten it yet. The call disconnected. So I suspect that's probably pretty familiar to all of us. But that was useless. However, while I was on the phone with them, I could have asked for specific coverage. Your mileage may vary. You may have to go through phone trees, et cetera, et cetera, et cetera. And when you ask about specific coverage, you should have your CPT codes of what coverage you're asking for, because they will be looking up by list to determine what is covered. And the trick here is that your insurance company, not necessarily insurance plan, but the broader insurance company will almost absolutely have a coverage policy document online about gender affirming care. And tip to search is the name of your medical company or insurance company, medical policy, and then gender, transition, words that we don't really want to talk about because they may still be using old language, etc. I was able to pull up the Cigna program policy. And this is what it looks like. Thankfully, they call it gender dysphoria treatment. And that policy, it's the broad policy, doesn't necessarily apply to your plan, but it will give you details about what Cigna, the company, is willing to pay for. It will give you a coverage policy, bunches of information on possible treatments that they would cover. It will also give you a list of the CPT codes and the procedures they are related to that they will cover. They will also give you the information they are going to want to submit a prior authorization, and I've highlighted them here. They're likely going to want you to be 18 or over, and they'll have a separate policy for under 18. They're going to want timeline of hormone use. They may have an exclusion for that, and they might state it. They may have information on how many letters you need, from whom, and what kind of provider from there. Let's see, any questions at this point? It seems like a good point to stop and check in. Okay. It may tell you about state-specific coverage. There are some states that require more coverage, and they'll show up here. And it may also tell you what they don't cover. Cigna as a company doesn't cover facial procedures. You can have a collective. I see Crystal smiling. This is who you're going to call. If you need to talk to someone about these documents because they are wordy and dense and use medical language and can be really confusing, there's that friendly who you're going to call number. It's the same people that I needed to call to get the documents themselves. Check the back of your insurance card. The number should be on there as well, and should be online before you even need to sign into your account. And we're up to when to do what. There are, of course, you don't have to strictly follow timelines unless they tell you to. They are likely to tell you to. And it can be confusing to line up when to get your letters, how long to have them, and when to schedule your surgery. So the first step is to find out what is and isn't covered based on what we've just gone through, and find out, does it need a prior authorization? Then it will tell you, the document should tell you how many letters do you need, who do you need them from, and how recent they should be. A lot of plans will ask for your letters to be less than a year old. Some may ask for them to be less than 6 months old. So there can be a little bit of an organizational dance between scheduling your consultation with your surgeon and then talking to insurance and then lining up your provider letters to make sure they are recent enough to make your insurance company happy, but still within the time that your surgery is planned to happen.
And to be very clear, if they're requiring letters from multiple providers, all of those visits should be covered under your plan. So historically in Medicaid plans, they will not cover for 2 different mental health providers. Like they say you have to establish with someone and stay with them. And so when your actual insurance company, though, is requiring you to see more than one provider to get these letters, they then have to cover the visits that you're required to see those people for. That can be a paperwork nightmare sometimes, particularly with like Alaska State Medicaid, but they are required to.
My cat has just arrived, so you may have heard him. The next step is to talk to your referring provider or providers to schedule those visits. Who your referring provider is may vary. It could be your surgeon who writes the letters to your insurance. It could be your gender affirming care provider. It could be your primary care provider. The referring provider is the person who is responsible for submitting the prior authorization request. And as we said, prior authorization is your insurance agreeing to pay for your procedure. You may need either or both medical and pharmacy prior approvals, depending. And they don't always tell you if you need a medical or a pharmacy auth, and you might have to get both of them. Because if you're denied, hopefully the denial letter or message or fax will tell you why. After a denial, you will have the opportunity to correct the errors. You can ask your provider to submit again. I recently had nope, this isn't covered. I called and they had never submitted it. So check in to find out if your insurance has even been asked. The process of getting through a denial can be extremely heavy time cost and emotional cost for you, for your provider. It can be hours of phone calls and faxes. To appeal, often your plan will give you specific instructions for their escalation process for appeals. Some of the terms you'll need to know for appealing is peer-to-peer, and that's when your doctor talks to a doctor at your insurance company to describe what's going on and why you need the care. Often,
And
a
you usually
peer-to-peer
have to do that for, oh, sorry. I just want to make the point that has to be done before you actually file an appeal. Because if you file an appeal, the peer-to-peer option is gone.
utilization review, there should be a utilization team at your insurance company. You can request that they go through all of the documents and details to make a case that you should or should not get this care. You can contact a patient advocate either at your insurance company or there are plenty of patient advocates available in the community. You can often find one who is low cost or free. The patient advocates at your insurance company should be free as a part of your benefits. Did you see?
Kayla asked peer-to-peer in more detail. I'm unfamiliar with the term. So peer-to-peer is when your referring healthcare provider talks to a healthcare provider who works for the insurance company and is in charge of reviewing the case. And so basically your provider would make the case to that provider that's employed by the insurance company as to why it should be covered. And sometimes they will then approve coverage, even if it's like categorically denied in the, it's like an excluded thing or whatever. Sometimes they'll cover it. The provider from the insurance company will choose to cover it because like your provider made a good case and provided good evidence and says it's community standards and here are all the research articles supporting it. And sometimes that peer reviewer will still say, you know, it's just not included in this policy, even though it is appropriate care. But basically what your provider is trying to do is like make the case for medical necessity and show all the research and literature supporting it and get it approved.
And then community standards, that can come up during an appeal where, again, you can pull up all the laws that say you should be able to get this care, all the other insurance companies that provide coverage for this care, and then you make the case that your insurance company is going to look really, really bad if they don't pay for your surgery. Strategies, we just started talking about a little bit. There is a possibility, if you want to go this route, you can submit a prior authorization even if you know it will be denied. It'll be a long process, but eventually you might get it covered. It can be emotionally draining. Any tips on that, Crystal, other than be prepared for a long, hard process?
Yeah, I would say like the vast majority of them are denied even on the appeal process if it's already excluded from your plan. So if your coverage documents say it's excluded, I always tell patients we can definitely try because there's an off chance like we get the nice peer-to-peer reviewer who says yes, you know, or there's an off chance during the appeal process, like somewhere along the chain, like someone does decide these community standards matter and we should follow through with this. But I would say it's like a 90-10. So like 90% of the time you do this process, it gets denied. You file the appeal, it gets denied. You file the secondary appeal, it gets denied. I would say like maybe 10% of the time I've had them covered. And so there's like a small chance. So I do tell patients like if they're willing to go through that paperwork process and like the emotional like feelings about things being denied and getting recurrent denials, then I'm willing to go through it with them. It does require several more medical visits though, because basically this ends up being a lot of time and paperwork for like for me as the provider and for my staff. And most healthcare like clinics, we don't actually get reimbursed unless you're there with us, right? So our clinic's a little bit different because we don't bill insurance, but for jobs where we do bill insurance, we can't typically bill for our time working on things unless you're there with us, which is frustrating when so much can be done remotely and so much can be done digitally and you don't really need to be there for the process, but your provider won't have time protected in their schedule to do this advocacy for you, right? Because they're going to be scheduled to be seeing patients 18 to 26 a day, right? So they won't have protected admin time to do this for you. And then also the clinic won't be compensated by your insurance company for the time they spend doing that. And so it ends up, like, I work at an LGBTQ nonprofit, right? And we don't cap our Medicaid. And so we have to have our patients in front of us, because otherwise we don't make enough money to keep the clinic open. It's literally like we are running on like a shoestring budget. And so that's why we ask people to come in. And it's really, it's frustrating for all of us, because like we don't want to make you come in. You don't want to have to come in, but it's like literally the only ways we can keep the door open and have protected time in our schedule to do this paperwork and advocacy process for you. So to be clear, I don't agree with the current US healthcare system, and I'm in no way trying to make it anyone else's burden. I just want to be like really transparent about what is happening as the provider when we're going through this process. Please vote for socialism, FYI. Okay. And then, can a patient submit a prior authorization request on the basis of a letter of medical necessity, or does it always need to originate with the provider? That's a really good question. Do you know, Nora?
Yes, a patient can submit an initial letter, and TransEquality has a template for what you can submit to start with.
Perfect. And then what I described as a problem with local, yeah, it's a problem a lot of places, for sure. But if you want to go through the denial process, an appeal process with your provider, just anticipate having to have extra visits with your provider so that they'll have that protected time in their schedule to do the advocacy for you. And unfortunately, that does mean like you'll probably end up with more copays and more potentially time off of work or life. So think about that as well. But like I said, slim chance. I've definitely had a couple of things get approved that were like literally excluded on the plan. So it's really exciting when it happens. I had a facial surgery coverage, which, was big because it's like a hard one to get covered, and it's very, very, very expensive, especially if you do it in the United States. So we were very excited. And the case we made for that one was the person actually worked in a Department of Corrections. And so we like made a very large case about safety in the work environment. And that's how we ended up getting that one covered.
Thank you for all that information. This next slide is just a screenshot from my plan booklet that they include how to start the appeal process. Resources. Utilize a care navigator. Check with your local LGBTQ center. That link goes to a directory of centers in the United States. If you're a queer doc patient, I do this as part of my work. TransEquality has a step-by-step guide. We had TransHealth.org mentioned earlier. TransFamily support services are amazing. If you've been denied, they are incredible. Let's see. These are things you wanted to know, or questions that were submitted with registration. We had someone asked about getting hysterectomy approved without HRT. In Washington, Apple Health Medicaid specifically allows this. You will likely need to submit a prior authorization indicating that HRT is not appropriate for you. And hopefully that works. Puberty blockers, you will likely need a pharmacy prior approval. We have just done this with one of our patients, and it took several phone calls, several faxes, more emails, but was approved. And we have a new puberty blocker going. But the trick with that was getting the pharmacy prior authorization rather than the medical prior authorization. Letter templates, I'm sure you can hear my cat. Trans Equality has templates at that link for both providers and patients.
And so Alex asked about insurance policy specifies HRT is required. And so I've seen multiple variations of this working with patients. I've seen certain plans where they'll just say, like bilateral mastectomies don't require 12 months of hormone therapy. So they'll call out specific procedures that they accept to the like continuous hormonal therapy requirement duration. And then I've seen policies that will say, 12 months of continuous hormone therapy is required unless it's incongruent with the patient's goal. I've also seen policies that will say unless it's incongruent with the patient's goals and or are medically contraindicated. And then I've seen policies that just say 12 months of continuous hormone therapy is required, right? So there's really a ton of variations, and sometimes they'll vary by individual surgeries. It is one of those things that I always say, if my patient's willing to go through a potential denial and appeal process with me, it's something I actually think we should try for, because it's not a clinically or medically relevant decision that they're making that deciding factor on in their insurance coverage criteria. And so this is one of those, it'll very likely get denied the first time you apply for it if you don't meet their by the letter criteria. And then I'm going to try to do that peer-to-peer and talk to that peer reviewer and say why hormones aren't appropriate for this patient, and why this surgery is. And then hopefully that peer-to-peer will see eye to eye with me, or we'll go through an appeal process. Specifically for hysterectomy, though, a lot of times patients just try to get those under a different diagnosis code if they don't want to take gender affirming hormone therapy. So, heavy bleeding or painful cycles or fibroids or whatever. So a lot of times, if you can find an affirming surgeon who's willing to kind of say, yes, do you have any of these symptoms that will qualify for coverage? We'll do it that way. So it's knowing who your local surgeons are who are like affirming of the community. And then I'm wondering if I should switch my insurance or not. I'm under my parents at the moment. It's Blue Cross Blue Shield in Michigan. I live in New York, and all the folks in New York say Medicaid is amazing. But I feel like I'll lose taking advantage of being in my current insurance because I'm only 22. Wondering what the best thing to do is. I'm really struggling. I guess specifically, I would wonder if your plan, your Blue Cross Blue Shield, like what the coverage is in that. I would think Nora would agree with me. Like, you would want to compare what your current plan covers versus what Medicaid in New York covers, and see. And probably, I mean, my gut instinct, Nora, is that like Medicaid's going to be cheaper overall, because typically Medicaid, you don't have like a significant deductible or copay for surgeries. Right. So for your private plan, you might end up paying like you saw Nora's, it was like $1,500 deductible and a $3,000 max out of pocket. So you might end up paying $3,000 to access a surgery. You will have a lot more surgical options with a private plan than with a state Medicaid plan. So there will be a lot more surgeons who take private insurance plans than your state Medicaid plan. And almost no surgeons out of New York will take New York state Medicaid, right? So state Medicaid plans are typically only taken by surgeons who live in that state, which is broad generalizations. Nora, do you have anything to add?
I would add that go to your ACA marketplace for New York. They will have people who can walk you through all of the available plans and help you make that decision. So they can help you compare plans.
Yeah. It'd be good if you had your Michigan book with you when you did that visit.
This is the end of the plan presentation, so I'm gonna take the presentation down and just open it up to all questions. I know we have some in chat.
Okay. The AC in New York, what's the AC stand for?
ACA. So
Affordable Care Act organization. Okay, and then we have, if you want to switch off your employer health insurance and move to a state marketplace, since it covers more, you have to have a qualifying event or wait for general enrollment, ?
yes, there may also be a clause with your employer health insurance, with a marketplace plan, that if you are eligible to get insurance through your employer, you must get insurance through your employer. So check with your marketplace first. Yeah, do you have any questions about what qualifying events are or further information on that? Ben, right?
And do you happen to know, Nora, if Washington requires you, if you're eligible with your employer?
I think so.
Okay. And then no more questions on qualifying events. And then, is anyone at our office accepting patients? Oh, yeah. Yes, we are. We only take payment on sliding scale, so we don't take insurance at ClearDoc. And so patients just choose what they want in the sliding scale range and pay us. You can use, if you have an FSA or HSA, you can use that to pay for your visits. And you can also potentially submit your payment documents for possible out-of-network reimbursement if your plan includes that.
Yeah. Okay. If you're interested in becoming a ClearDoc patient, request intro 15-minute appointment with me through our website, cleardoc.com. This is Usul.
Also, I pulled up that Michigan plan. Do we have other questions? I'm in Washington State under, oh, your cat's adorable, someone says. I'm in Washington State under Cigna Open Access PPO. I've already had a top surgery consult scheduled for an in-network provider, and they told me the steps to follow to get pre-authorization. Can we help you out with anything else in this process? Nora, I just was like, I don't know. I mean, I'm a physician. I see patients and refer them for surgery, and Nora helps people understand their insurance benefits. We don't have mental health provider on staff currently, so we can't do mental health referral letters. Do we do anything else, Nora?
I think so. Yeah.
Is there like, oh, sorry.
I could do a care navigation visit going through all the documents, so I can use my knowledge to understand everything and get clues as to better.
Okay. B said they have to run, but they appreciated it and it was great. And so yes, if you run into issues with your insurance, definitely, I have had patients come to me specifically to access surgery when their regular referring provider just wouldn't like do enough, I guess is maybe the right. I'm not trying to throw any other providers under the bus, but you know, trans healthcare is all I do all day long. So like I have like the reference articles that I just like copy and paste into my letter that I send to your insurance company. That is like, these are the 17 articles on like why this surgery is like considered medically necessary and appropriate and has positive outcomes in this patient population. So probably my letters are a little like more intense than some like community provider letters, but also like the person who came to me to get facial surgery covered has like a great community provider who just didn't have the time. You know, he works at a huge health system in Washington, you know, and can't carve out an hour a week to talk to someone's insurance company until surgery is covered. And so, you know, because I'm a sliding scale cash pay practice, my schedule is different and my hours are different. And so she came to see me, for maybe 3 or 4 visits during that process. And then each time she saw me, I would be working to talk to her insurance company. So it is unfortunate because like you have to pay to see us, and I wish healthcare was free in the United States. But by paying, sometimes you can have a provider who's a little more, has more time to spend on this, I guess, if that makes sense. And then can someone tell us more about TransNav USA?
That is the Navigator's listserv, and I can't, it's brand new. Was that Kayla? Are you on the listserv? Okay. I believe one of the mods of the listserv sent out a message today describing it, and they're probably the best people to contact. And then Saga, yes, we are going to send everyone a link to, we'll be posting this and all the links in one document on our CME group, Queer CME.
Yeah, that'll be free to access. And then there is a counselor. What is her name? I'm like, Cheryl. What's her last name? I know there was a mental health. Wait, what did you say?
Instead, I think Cheryl.
Yes, Cheryl Instead. Cheryl Instead is a mental health provider in Washington State who has a trans child, who I know on her website was planning on actually organizing a bunch of research articles for each surgery type. So like her goal on her website was to basically have like a list of all of the articles that support that surgery. So it's much easier for other providers to just pull it and pop it onto their letters. I'll see if that part of her website is up yet. Last time I talked to her, she was still in the planning phases, and we'll pop it on the resource list if it is.
Do any of you or my other navigators have other resources we should know about? We're happy to add those to our list as well. And you can email me at facilitatorunicorn to share those, or put them on the listserv now that we have it. Crystal, we don't have the, I am blanking because I've talked too much today. We will send out an email to everyone who registered to the link where our list is going to be. It will be at the new URL is queercme.com. Crystal?
Yeah.